Where is the esophagus near the thyroid gland? Have you ever wondered about the relationship between the esophagus and the thyroid gland? Understanding their anatomy is essential for grasping how they function together in the body. The esophagus is located just behind the thyroid gland in the neck. To be more specific, the thyroid gland is situated in the lower front part of the neck, right in front of the trachea, which is also known as the windpipe. The esophagus, which is the tube that carries food from the mouth to the stomach, is positioned directly behind the thyroid gland. The thyroid gland has two lobes that are connected by a small bridge of tissue called the isthmus. This isthmus crosses over the trachea, and the esophagus lies medial, or towards the midline of the body, and posterior, or behind, this entire structure. This close anatomical relationship is significant, especially when considering thyroid disorders or surgical procedures involving the thyroid. The thyroid gland extends from the level of the fifth cervical vertebra down to the first thoracic vertebra. It is surrounded by a layer of connective tissue known as pretracheal fascia, which also envelops the trachea and the esophagus. This means that any enlargement of the thyroid, such as in cases of goiter or nodules, can potentially compress the esophagus, leading to difficulties in swallowing. In addition to the esophagus, there are other important structures located near the thyroid gland. The recurrent laryngeal nerves, which are crucial for voice function, run close to both the esophagus and the trachea. The parathyroid glands, which regulate calcium levels in the body, are also located on the posterior surface of the thyroid lobes. Understanding the proximity of the esophagus to the thyroid gland is clinically relevant. If the thyroid gland becomes enlarged, or if surgery is performed, there may be implications for swallowing function or symptoms of esophageal compression. This anatomical knowledge is vital for healthcare professionals when evaluating thyroid health or planning surgical interventions. In summary, the esophagus is situated immediately behind and medial to the thyroid gland, lying just behind the trachea. This anatomical relationship is essential for understanding thyroid function, disorders, and the considerations that come into play during surgical procedures. Always remember, if you have concerns about your thyroid or esophagus, consulting a healthcare professional is the best course of action.